So after loads of research into what I've been telling you about my health, I've done my own research online trying to find out, and obviously finding out what was wrong with Carrie, trying to find out what to do and where to go from here. So that lands me here at 60 Harley Street. So I'm about to go in and meet somebody that is absolutely phenomenal, and these are changing the way and hopefully the way that NHS will look at iron deficiency, low iron deficiency. In this building here is a professor. He's called Professor Toby Richards, and he has roughly around about 4 or 5 people I think that work for him. One of them is Dr Caitlyn Scott, whom I spoke to. Professor Richards is, I do believe he is a cardiovascular surgeon for the NHS. He probably does it privately as well. He is also the leading iron specialist in the UK, researcher in the UK, in Australia and internationally. This is an amazing woman. This is the woman that I spoke to straight away. She is Dr Caitlyn Scott. This is, when I rung the iron clinic, you're the first person that I got through to. And basically this is the doctor that's taught me everything that I now know about low iron deficiency. So thank you so much for doing this interview. You have been, I mean, I said it to you like an angel. It was like music to my ears when you're going, yes, yes, that's the man, that's the one. Yeah. But how did this clinic start off? Because it's actually Professor Toby Richards, isn't it, that runs the iron clinic. We're actually sat on 60 Harley Street at the moment. How did it all start out? How did he find all this?
So Toby is a vascular surgeon, and he was working from University College London, and he was working at UCH Hospital, and he took a group of cardiac preoperative patients and they randomized and treated half of those patients with a single dose iron infusion, and they treated the other half with a placebo. And they then measured the post-operative outcomes, and they found...
So this was with heart patients, sorry?
It was heart-specific patients that were having operations a week before, so a fair amount of time before the actual procedure. And they found that it had such an incredible effect on the post-operative outcomes in that it decreased the morbidity, so that's the number of complications that the patients had, the number of blood transfusions that were required to treat those patients because of blood loss that they had in the procedure. But they also found that it had such an impact on the patient's quality of life, in that the patients felt so much better in terms of symptoms that they'd been having before the actual operation that were not specifically cardiac symptoms. And so the clinic was kept open to create access to the treatment and to basically offer iron infusions to the public as self-referred patients.
How did he then sort of broaden his research? Because obviously if he's a vascular surgeon, he specialises in the heart, obviously, so then he's sorting out and looking after his heart patients, giving part of them the iron infusion, part of them placebo, which I always say, can you imagine being a placebo? Just to go through what a placebo is, just in case you didn't, because I would be exactly the same. I'd be saying, what the heck's a placebo? It's basically somebody being given the iron infusion and somebody being given coloured water. So you don't get given anything, but you have to do it that way to see who gets the results. And that's every trial that's ever done. I mean, if you watch me on television on a regular basis, you will see the product that we sell, which is the collagen shot, which is the protocol. That was also done on they call it a double-blind placebo. And it's just, I always, and Dr Caitlyn and I were just saying, can you imagine being one of those that was on placebo thinking, you know, well, I wanted the real thing. But how on earth did he then broaden this? Because he's been finding so much more out from what iron does. How on earth did he find, because this really is mainly a woman's problem.
Yes, yeah. I would say about 90% of the people that we see are female. And the odd man that we do see is somebody who perhaps has an inflammatory bowel disease or a cancer or some kind of a bleeding gut condition. So they have a specific condition that predisposes them to developing iron deficiency. Whereas with women, 1 in 3 lifetime risk of developing iron deficiency because we bleed and we have children.
So it's periods.
Yes.
What did Dr. Rao call it?
Menorrhagia.
Menorrhagia. So if you heavily bleed every month.
Yeah.
Also, you're sucked of iron when you are pregnant.
Yeah.
You're sucked of iron when you give birth.
Yeah.
And then you're sucked of iron if you breastfeed.
Yeah.
So all of these things. So was it Dr. Toby Richards that was finding all this, or was he also working with other iron clinics around the world to find out this sort of information?
So he, after doing that initial trial, I think his interest was piqued in that. So he wanted to do some more research into it. And so he used the iron clinic to source patients that he could glean whatever information he could. And so we obviously were measuring blood levels, we were trying to measure symptoms, we were trying to measure risk factors. And from all of that data that we collected, from all those different patients that have come through the door, we've managed to put together a number of academic journal articles and academic posters that have actually been presented at various conferences over the last few years.
But what was very sorrowful that you said to me the other day was that it takes quite a lot of time for that journal to get out into the NHS.
Yeah.
And then it takes, well, a doctor might not even pick up and read it because, and I'm not blaming doctors or GPs, they might not have time, and there's that much new research being done on it. But this seems to be, it's not a little thing. This is something that can affect the heart, the lungs, the blood, your nails, your hair. I mean, that is nothing compared to everything else, but it can affect your thyroid, it affects your muscles, it affects your sleeping pattern, it affects your weight, it affects your mind, it can give you depression. They're now looking into it, postnatal depression, postnatal anxiety. If you suffer from anxiety, it could possibly be your ferritin.
Iron deficiency is something that develops quite slowly over time. So if you imagine somebody that has heavy menstrual bleeding, maybe for the first 2 or 3 days of their periods, they bleed heavily. And for those 2 or 3 days, they are losing a lot more iron than they are able to absorb through their diet or even iron tablets that they're taking. That happens every single month for a good couple of years. And like a lot of the patients that we see, they have 5 to 10 to 20 year history of a lot of these vague symptoms just becoming slowly worse. So to the GP, if you have a 5 or 10 minute consultation with the GP and you name fatigue, hair loss, a little bit of a low mood, maybe a little bit of anxiety, that GP, I just don't think that they are taught to think about iron deficiency as a cause for those, because they are such vague symptoms. And what a lot of them end up saying is, you're a mum, you've got 1 or 2 children, you work, you run a home, of course you're feeling like that. You know, it's normal to feel like that. They send you for a blood panel, they check your hemoglobin, you're not anemic, so actually there's nothing wrong with you. You know, you need to go home.
Or they look, if they do check your ferritin, they're checking your ferritin on the guidelines of the NHS, which is between 10 and 291, and really, and this is a doctor, she's trained, she was a doctor, obviously from South Africa, she was a doctor for 4 years, and now you work with research for well women. That guideline on the NHS is wrong.
But it's a worldwide problem. So I worked in a GP practice, a private GP practice in South Africa that focused on women's health. That's where my interest in women's health was piqued. And even I wasn't aware of this until I moved to the UK and met Toby. And it literally was a discussion that we were having. He was telling me about this iron clinic and I was telling him about my interest in women's health. And he said to me, we're going to get you working there. And slowly taught me everything that I've learnt about iron, and it is mind-blowing how little I knew about it before.
But yet you worked in that area.
And yes, I was a GP working in women's health.
You can actually send your blood tests into either Dr Caitlyn, Dr Sandy. They will look at you here at the Iron Clinic completely free of charge. Obviously, if you want to go and have an iron infusion, that will cost and they will give you the details, but they are a heck of a lot less than a lot of other iron clinics around, purely and simply because they just really charge to run the clinic and for the iron, whereas a lot of people also do it as a business, but that's not what Professor Toby Richards is about. How do they contact you, Dr Caitlyn, if they do want to send their blood results into you?
So the best way is by email. So if they email their blood results and a brief description of some of the symptoms that they've been having to info@theironclinic.co.uk. That will come through directly to myself. I will review the blood results. I will check to make sure that there is evidence of iron deficiency, and I will also look to see whether the symptoms match up to the blood values. And that's mostly to make sure that the iron infusion is actually going to help you to feel better. If, in my opinion, it doesn't look like that's the case, then I'll actually say to you, look, I don't think that your symptoms are being caused by iron deficiency. I think it's possibly something else. If it does look like iron deficiency and you would benefit from the iron infusion, then we book you in directly from that email into one of our 4 clinics to have the iron infusion.
Oh, 4 clinics. Where's your other clinics?
Chelsea Pharmacy Medical Centre will be opening soon. So it's a second London location.
So there's Harley Street, Chelsea and
Surrey and Cambridge.
Oh, Cambridge. Oh, Cambridge is close to me.
Yeah.
Well, it is where I work. Not because I'm from Burnley, aren't I? Anyway, so we travelled down half term, spent a bit of time with friends and family at the same time. That's why I did. But it was only, I mean, gosh, I only spoke to you about 3 weeks ago, and I've been on it straight away, because I don't feel that for me, how I've been feeling for so many years, I've looked at it and thought, do you know what, the money isn't, and the money can't be an issue here. I've got to get this sorted. But I do understand that there'll be a lot of people that maybe can't afford it, which is what I said to you right at the beginning, isn't it? If this is a single mum that may be having 3 kids, that's low in iron because she's breastfed and she's running around, she's trying to hold down a job, and she is suffering from this. This is what the sad thing is. That she probably won't be able to go and afford an iron infusion, and this is why I want to get it more widely known for doctors to help people like this. So please pass this on, please share it. All the details I've given you in the description below. I'm going to try and do my best to try and get this out. If you've got anybody that wants to cover this story, get hold of them, get hold of me. This needs to get out there. But also, you do seminars, don't you?
We do. So our team is very small, but we are all very passionate about this, and we are willing to come to any form of seminar of health professionals or nutritionists or anybody that is interested, and we will present some of our research that we've done, we'll present some of the experiences that we've had in the Iron Clinic, and we are happy to talk about it to anybody that wants to listen.
Actually, you can get this done in your area. So for instance, mine would be within the East Lancs area. I'm going to try and get that. You can set it up. You could even get it funded and get your GPs along, get them to learn about this. Because unfortunately, general practitioners, as good as they are, the doctors, they are not taught enough at college, university, whatever you want to call it. They're not taught enough. It's a very small part of their learning. So
the part of my job that I love is that I get to sit at the other end of the telephone, and it is absolutely free to phone into the clinic, and you will speak directly with myself, and we can chat through your symptoms, we can chat through your experiences, and it doesn't cost you anything to find out that little bit more about
just like I did.
Yeah.
And she was fantastic, absolutely fantastic. So I will tell you my progress, because I won't get any real reaction from this. Within a week, I'll start feeling a little bit better. It's going to be 6 to 8 weeks before I feel any benefit from the iron infusion. I feel mighty fine now. I've got no side effects at all. So follow my story, do subscribe here, but any information you need will be in the description below. If it's not, write in the comment section below and I will give you that info, because I want to spread the word about this. Thank you so much. Thank you to the Iron Clinic, thank you to you, as always, love you lots. I will see you tomorrow, and thank you to Dr Caitlyn Scott, you've been absolutely magnificent.